Well, during the recent Mate Show and Home and Health Expo in Billings, Montana, over 550 booths exhibited some of the latest in technology and services impacting our farmers and ranchers and others that live in our rural states like Montana and Wyoming. And one of this year's trade show exhibitors was SCL Health. And of course, healthcare is a big issue whether you live in town or you live out in the country. And with us from SCL Health today is their Martha Nikitas. And Martha, let's talk a little bit about rural health care and a little bit about what you folks at SCL Health are being able to offer some of our more rural residents in states like Montana and Wyoming.
Sure. So we have a couple of emergency services that we provide. We've got emergency providers that are board certified in our ER, and they're actually able to take video calls from rural hospitals when they've got patients with a trauma, or they might have chest pain, or they could even have neurological symptoms like stroke symptoms, and they're calling in and having a consultation with one of our physicians to try and keep the patient home if at all possible, or if they have to be transferred, maybe doing a little bit extra to get their transfer a little cleaner.
Maybe walk us through the footprint of SCL Health, if you will, a little bit, because you are pretty large out there across our coverage area.
Sure, we've got three hospitals in the state of Montana: St. Vincent's here in Billings, and we have Holy Rosary in Miles City, Montana, and St. James in Butte, Montana. And then we also have a bunch of rural clinics that are St. Vincent's based, and one of those is actually in Cody, Wyoming as well.
Perfect. How is telemedicine really changing things? You and I were talking about it. Makes better sense to use some of this modern day technology like telemedicine instead of having little clinics scattered across our rural geography, so to speak, where they can just really tap into the better expertise, the better doctors, and still have that same great health care.
Sure. We've actually got a number of outpatient providers too, specialist providers, that are able to see their patients out in those rural communities so they're not having to drive here for every one of their visits. We have a diabetes internist that is actually doing visits to Holy Rosary and St. James and a bunch of other clinics as well. And then we've also got an oncology service that's been running for almost 10 years now that is doing services with Holy Rosary in Miles City, where the patients can receive their chemo there, but also see their doctor on a regular basis without having to drive to Billings.
Well, you guys are providing a tremendous service to our farmers and ranchers and other folks in rural America out here in Montana and Wyoming. Anything else that you guys would want to pass along before I let you go?
We just encourage for the patients to know that these services are available and that many of the hospitals and clinics in the state of Montana can actually provide this, and they can host their patients without them having to come to the bigger cities, and they can see their specialists over telemedicine.
Perfect. Well, thanks for joining us today.
Yeah, thank you.
All right, again, it's not just the latest in egg technology here at egg shows like the Mate, but it's also healthcare technology.